Hello, my name is Katz. I am an emergency physician working in Winnipeg as well as in rural Manitoba and rural Southwest Ontario. Today we are going to demonstrate a number of different techniques to remove an incarcerated ring. Incarcerated rings are a common occurrence that we see in emergency departments and can lead to loss of digits from ischemia if left for too long. So these are the Raptor devices, which are not technically a medical device, but do have a marketed addition, which is a ring cutter. This will only work on soft metals. You simply place the cutter underneath the ring, and then once you are there, it is just squeezing. Often you will need to make 2 cuts to get it off, and if you have, you can take it out like that. This is part of the Dolphin Ring Rescue Kit. This is a compression device to try to decrease the size of the knuckle. Again, trying to get the ring over top of the knuckle is the biggest issue when the digit gets swollen. So this device simply goes over top of the knuckle itself and works like a typical blood pressure machine or sphygmomanometer. You pump it up. So this would be left on the digit for about 3 to 5 minutes. And if you wanted, you could elevate the hand like this, which again would just promote the reduction in swelling. Once this has been left on, you would release the air through the valve, and then again, trying to just get it over the knuckle. To use the dental floss technique, you take the end of the floss, make a simple loop that you then place over top of the finger, and then simply start making circumferential compression around the knuckle itself, which compresses the swelling in order to get the ring over top of the knuckle. Once you have wrapped adequately around the knuckle itself, you push the end of the string underneath the ring, which sometimes may require an additional tool just to get it under. And then gently adding traction with your other hand, you pull towards the knuckle itself. And then as you can see, the ring simply slides over the knuckle and comes right off. The same procedure as just done with a dental floss can be done, if available, using petroleum gauze tube foil, which is often stocked for epistaxis management in the emergency departments. And that one has pre-lubrication on the actual string itself, which may allow for easier removal of the ring. So this is the Dolphin Ring Cutter, which is, again, a newer device developed by Ring Rescue. So the way that this works is you turn it on. As this disc has already been used on the device, we are going to swap it out for a fresh disc, as they are typically single use. Once this is completed, you slide the little latch underneath the ring. The hand can rest comfortably, and the device itself can angle correctly on the table. You push your button to ensure that there is contact from the disc and the ring. Again, prior to starting, you do want to lubricate to ensure smooth operation. And then simply start the cutting procedure. There you go. Again, the blinking blue lights simply indicate a reminder to add additional lubrication as needed. And although this does not typically create a great deal of heat, always remind your patient to inform you if they are in fact feeling any pain at any point in time. Okay, the lights are flashing, indicating we are completely through at this time. We're going to raise the disc and determine if the ring is able to be removed or if a second cut is required. You can see that perhaps we have released enough compression around the knuckle that it can be removed with just some gentle traction, as such. As you can see, there are a number of different techniques to help remove incarcerated rings and to avoid significant problems for patients such as digital ischemia. If you do not have the appropriate tools that have been developed, there are always means in which you could try to avoid the requirement of transferring from a rural to a more high resource setting.